Hi, I'm Dr. Christopher Jones. I am a plastic surgeon practicing here in Indianapolis for about 30 years. For many years, I have been doing wrinkle filling. Various agents were invented years ago to try to go in and fill small wrinkles. A more modern concept now is to restore volume to the cheek up here to give a better youthful restoration. There's a product called Voluma. It's a type of hyaluronic acid. It is made by the human body, and we're going to demonstrate on our live subject today exactly how that's done. First, we analyze the atrophy of cheek fat which occurs during the aging process by making specific markings, identifying the areas where the least Voluma will do the most good. Tiny volumes of Voluma will be delivered deeply in the cheek tissues. In this way, we'll slowly build up the volume we need rather than hastily inject larger volumes. After local topical anesthesia, the initial injection is made at the side of the cheekbone, beginning to restore the width of the face. Progression from the side of the cheek to the center, and finally, the region next to the nose seems to work best. We rarely exceed 1 cc of Voluma at a treatment, preferring initial subtle results over a risk of overdoing the treatment volume. The patient returns in a couple of weeks. If they want more, they can have more, but I find this has been very rare. While I do a great deal of facial cosmetic surgery, this modern technique of facial volume restoration is now putting off or eliminating the need for more expensive and invasive surgical procedures. As the patient's physician and surgeon, I am in favor of that. So if you feel like you are a victim of facial aging, or you've got some facial volume loss, especially around your cheeks, come in, I'll see you for a free consultation, and we'll figure out whether Voluma is right for you.